Hello, I'm Alan Jansson from acupuncture-goldcoast.com and acupuncture-brisbane.com. I would like to take a couple of minutes of your time to talk to you about traditional acupuncture and how anyone suffering from osteoarthritis might benefit. Osteoarthritis is extraordinarily common in this day and age in the Western world, for a variety of reasons. Lifestyles, one, inordinate amount of sitting or repetitive actions, physical actions. I commonly see what we call tradies, carpenters, builders, plasterers, tilers. They're common trades where osteoarthritis it becomes a very prevalent condition as they move into their 15th or 20th year in their trade. Osteoarthritis is also quite prevalent with women as a result of the vulnerability from an Oriental medical perspective. That's directly related to a woman bearing children and the menstrual cycle. These factors lend a vulnerability to women to osteoarthritis. Osteoarthritis is a degenerative condition of the bones, which we get what we call like a calcification. It's like a build-up of sediment almost. It's a protective layer that the body builds up at the bone ends to prevent wearing, and it creates an irritation or a grinding. In the hip joint, this can cause a real wearing and tearing as the bursa or the fluid sac, as the shock absorbers of the joint start to deteriorate with age and use. Then the bone ends start to become worn, and the body creates calcification, and then we get a situation where the bones are kind of grinding on each other, and there's a development of osteoarthritis, which is an arthritic condition of the bone ends. This is very prevalent in the hips, the lower back, the knees, to some degree in the ankle, although I don't commonly see cases of ankle osteoarthritis. There's no doubt that it does exist, and in fact it exists in all joints, in the finger joints, the wrist joints, elbows, shoulders, the cervical vertebrae in the neck, the thoracic vertebrae in the upper back, but more prevalently in my clinical experience in the lower back, in what we call the lumbar vertebrae, in the sacroiliac joints, in the hip joints, and in the knees. I do a lot of work. A huge amount of my work is working with people suffering from the pain and the discomfort of osteoarthritis. At the moment, I would say I'm working with between 7 and 10 patients with lower back conditions that have an element of osteoarthritis about them. And also I'm working with a recreational climber, and she has a significant amount of osteoarthritis in her knees as a result of climbing for 30 years. This is constant knocking and the use and the grinding of the joints that affect them. Obviously, there's some degree of this with retired professional athletes, and there's a tendency also to build up the arthritic condition, the osteoarthritic condition. Traditional acupuncture combined with what we call moxibustion. I won't go into that heavily, but it's a heating substance that we use to warm the area. I find in a majority of cases brings about an extraordinary amount of relief for people suffering from this very painful and inconvenient condition. Over a course of several treatments, we can often bring people back to a much more livable state. It doesn't necessarily cure the osteoarthritis. To my knowledge, there's not a lot there's not a lot of modalities that would lay claim to curing, but we can help slow down the degeneration and help resolve a lot of the pain and discomfort and give back our patients some degree of pleasure and pain-free lifestyle. This is Alan from Acupuncture-Gold Coast and Acupuncture-Brisbane.com saying thank you very much for viewing this.